Welcome to the next session. We are so happy to see you and we're happy that you're here. All right, give me a thumbs up, a smile, a yes if you are being inspired, if you're getting great tools, if you're meeting amazing people, making new friends, new contacts. Give me a thumbs up, a smile. Let me know that this is an amazing experience for you. All right, so if you haven't already, join the game. You can do that on the left side, right? One of those tabs, join the game. You are collecting passcodes and points. And again, you might win a special swag bag, which Smile Train has put together. The questions are consistently changing, so lots of options and opportunities to get more points. If you haven't visited the video booth, have you visited? If you haven't, please go record a short video of yourself. Share with us a little bit about your story, words of inspiration for others, and what are your hopes and your dreams for the Cleft community moving forward. We want to hear from you all. We want to see those videos, and we know that that's going to make everyone feel more empowered. So thank you for that. And have you gone to the photo booth and done that selfie? We're looking for all those selfies as well. And if you've done one, go ahead, do two, do three. All right. So this session, we are ready to go. Counseling as a key piece of the Cleft treatment process. So as many CleftCon attendees know firsthand, surgical care is only one part of the Cleft treatment journey. Speech services, dental care, ENT care, and orthodontics also play a part of this comprehensive cleft care. And there's another important part as well. The component for both cleft affected individuals and their families is the counseling piece. It is the counseling and the support services that are vital as well. And so this session is focusing on how we can best support you in that area. We have Dina Zuckerberg, who is the Director of Family Programs at MyFace. We also have joining us Dr. Eileen Blitz, clinical psychologist and clinical adjunct professor. She'll have an overview of the psychosocial support systems provided by the MyFace Center at NYU Langone Health. We also have Grace Peters with us, Programs Associate for Comprehensive Cleft Care, and psychologist Camila Osorio. I hope I said that correctly. She's going to discuss Smile Train's plans to expand psychosocial support as a key element to their global programs. All right, thank you for being here, and let's sit back and enjoy.
Hi, I'm Dina Zuckerberg, and I'm the Director of Family Programs at MyFace.
And I am Dr. Aileen Blitz, the clinical psychologist at MyFace. Thank you for joining us.
MyFace is a nonprofit organization dedicated to changing the faces and transforming the lives of children and adults with facial differences. I myself was born with a cleft lip, a hearing loss in both ears, and no vision in my left eye. But it has never stopped me from doing anything I've ever wanted to do in my life. I had 6 surgeries growing up, from the repair of my cleft when I was a few months old into my adult years, orthodontics, and speech therapy. During my childhood, I was teased, kids would say mean things, I would sit alone sometimes on the school bus and in the lunchroom. And those moments have stayed with me even today. I was a patient for many years at the MyFace Center for Craniofacial Care at NYU Langone Health. I've seen firsthand how important it is to find a comprehensive craniofacial care team that includes a psychologist and social worker, as well as an orthodontic, nutrition, geneticist, and others, all under one roof. What makes the team at NYU even more special is that MyFace has worked so closely to provide additional psychosocial support and resources. And this is what I want to talk about today. When I started working at MyFace 8 years ago, it was really important to me to implement support groups, workshops, and networking opportunities for the individuals with craniofacial differences and their families. I never wanted any child to go through what I did growing up. Ensuring that individuals impacted by craniofacial differences across the country and around the world have a place to turn to for support is a core part of the work we do. The first thing I did when I joined MyFace was to create and co-lead peer-to-peer support groups for the adolescents, parents, and adults to provide guidance, counsel, and community for those living with facial differences and their families. At one point, I even had a group for the kids and siblings. Before the pandemic, these meetings would be in person, and when we went into a pandemic, we started doing the groups on Zoom. It has allowed us to reach even more people across the country and even around the world. For the adult group, I have people joining from places like New York, Connecticut, New Jersey, California, in the South, and even Australia, England, and Canada. The group meets 2 times a month and talks about relevant topics like dating and employment challenges. The group also is very interested in supporting the younger generation and even the parents as well. I truly believe there is power in the shared story in knowing you are not alone. I've seen this firsthand in the parent support group, where they talk and talk about the issues they are dealing with, from surgeries for their child to issues in school from their child being bullied and needing an IEP and other services. So a mom of a 20-year-old or a mom of a 10-year-old can help a mom who is just starting out on their journey, or a mom of a 3-year-old who is completely overwhelmed and can't see beyond where they are in the moment. The support they give each other is just amazing to watch. We've also developed specific workshops. For example, one of the things that I have struggled with is dating and relationships. So a few years ago, I worked with a psychologist, social worker, and a life coach to create a series of workshops on this important topic. We role-played, we talked about online dating, and even partnered up with someone and interviewed them before writing their profile for them. It was really powerful because they could see things in us that we couldn't see in ourselves. Before the pandemic, we also did a panel discussion on advocating for your school-age children. On the panel, we had the psychologist, social worker, someone from Advocates for Children, someone born with a facial difference, and 2 parents who all shared their stories and gave their advice. We had 50 parents attend this important workshop. Other topics over the years have included a workshop on creating social stories, a narrative video therapy project, on tools for dealing with bullying and exclusion, and more. Another thing that we have done at MyFace is that for 2 summers, we have sent children with facial differences and their siblings to a week-long camp in New Hampshire, which created an opportunity for them to meet other children who look like them and bond over fun outdoor activities. I have also recently launched and am hosting a monthly podcast series, My Face, My Story, Voices from the Craniofacial Community. This podcast educates the general public about living with craniofacial differences. The first episode was on the mask we wear, both literally and figuratively, and what is behind the mask. I think that the podcasts are really powerful in helping individuals to find their voice and use it so that they feel empowered in their own lives. These podcasts are broadcasted live on YouTube and Facebook and all other podcasting platforms. And then I just want to add that we also have a webinar series, Transforming Lives webinars, and one of which addresses school-aged children returning to school after COVID. So at MyFace, we really try to offer as much support and resources that we can to help individuals with craniofacial differences and their families to navigate the journey from when they are little into their adult years. So thank you so much for inviting us today to speak to you all. Thank you.
Thank you so much, Dina, for your wonderful presentation. I'm now going to speak a little bit about the importance of counseling as a key piece of the cleft treatment process. For children born with cleft conditions, medical issues, as well as psychosocial aspects involved in having a facial difference affect everyday life throughout their childhood and into adulthood. Having a full-time social worker on our Cleft team and myself as a part-time clinical psychologist allows our team to address these psychosocial issues and provide additional concrete services and resources to our parents and our families. Annual or more frequent clinic meetings help us to track patients' care progress and to determine if they require additional services such as counseling, tutoring, neurological or neurocognitive assessments, and any other kinds of specialized services. Counseling can begin with parents prenatally when orofacial cleft conditions are often diagnosed. Once a diagnosis has been made, parents will typically contact us in order to learn more about the diagnosis and related medical and psychosocial implications. I will help the parents to talk about and address their feelings about having a child with special needs, help them to process this new information, and help the couple dyad to best support one another. Answering questions about bonding with the child, what to tell older siblings or other family members about the child with the cleft, the taking of photos, sharing of photos. These are all topics that I address in counseling. The type of counseling that we do depends on how often parents may need our services. We may provide this counseling in person, online, by phone, on an as-needed basis, or more formally on a weekly or monthly basis. The psychosocial team can also evaluate, once we get to know the family, the coping styles of the mother, the father, or caretaker, and explore various aspects of their personal needs. We may look at things like personal or cultural belief systems, family dynamics, or other unique concerns of the family so that we can better assist our patients. We also provide psychosocial information in clinical settings, on webinars, as Dina mentioned, and in support groups. Our team social worker can provide referrals for early intervention services for children who may need special types of help, such as PT, OT, speech, many of the things that you are familiar with. Parents are often concerned about how a cleft may impact their child's intellectual functioning, their ability to learn, their speech, their behavior, and socialization. These are many of the topics that we counsel patients and parents on. As children begin preschool or kindergarten, they may begin to develop a sense that they are different from their peers. They might sound different, look different, or just internally feel that they're different. These are some of the issues that we address early on. We don't want children to start internalizing that there's something inherently wrong with them. Sometimes kids might present as more shy or self-conscious. They might be quiet in the classroom, or parents may tell us that their child comes home from school and is not speaking, went right to their room, isn't talking much. And these are some of the kind of red flags or signs that let us know that their child may need some counseling. For patients at this age, we often will make recommendations for play therapy and also for collateral counseling for parents to help them with parenting skills and to help them to better understand developmentally what their child may be going through. Siblings may also be included in these family sessions in order to help the entire family feel that they are part of the treatment. It's very important for parents to learn how to best talk with their child about their cleft condition and about how to teach their child to discuss their condition with others. Some parents will tell us they don't know what to tell their child. They don't always know what terminology to use. Sometimes they're not sure, should they tell them everything? How much should they tell them? So these are some of the topics that I help parents with and how to best talk to their child. We also try to help patients directly to talk about their condition with others. We try to help kids learn when it's okay to answer questions that peers or strangers may ask, when it's okay not to answer questions, and how to best answer questions. We also find that teachers and peers can provide much needed support for children since they are around children more often and parents cannot be with their child 24/7. We can assist parents in helping their child with transitions, which can be quite challenging, helping their child to deal with new schedules, helping them when they may need to be out of school for surgery or other procedures. As children are older, for example, between the ages of 10 to 15, myself or the psychosocial team members will help the pre-adolescent and adolescent children to deal with specific needs that they may encounter. Ensuring that there's an optimal understanding of their special needs and also perhaps surgical interventions is imperative. Making sure that there's good communication amongst a patient, parents, team members such as surgeons, speech therapist, the team nurse, geneticist. This is all very important for compliance and successful treatment planning. In addition, academic and behavioral and peer-related issues can also be addressed in counseling. Some more specific school-related issues, for example, for some children, as you know, who may have an IEP, an individual education plan, we help parents to learn how to best make sure that these plans are being utilized properly, that the school is providing these services, and we also can make referrals to parents for advocates for children or other similar types of organizations to make sure that these kinds of educational services are being met. One major concern that we have found in the children that we work with who have clefts is dealing with changes in their appearance over time. As their face grows, they may have different needs at different times. We try to be aware of that and try to address these special needs and understand how they may feel in terms of going back to school after a surgery. Sometimes we might counsel children or teens in what to say to their teachers, to their peers about why they might look different. We are very fortunate to have the support of MyFace to provide all of the wonderful programs that Dina mentioned, such as our support groups for teens, adults, parents, and the multiple webinars and activities that they provide for our patients. We thank you all for listening and hope that you will enjoy the remainder of your conference. Thank you so much.
Hi everyone, I'm Grace Peters, a Programs Associate at SmileTrain, working specifically to expand and grow SmileTrain's comprehensive cleft care programs. and I'm here with Camila Osorio, a Smile Train psychosocial advisor based in Medellin, Colombia. One of the many important aspects of comprehensive cleft care is psychosocial counseling and support. Research indicates that children with clefts are at a slightly higher risk of having psychosocial challenges. Children who are mocked and feel isolated will often have poor self-esteem and negative self-image. And even having cleft surgery at an early age is often not enough to make these issues go away. Therefore, it is essential that children born with clefts alongside their families have access to psychosocial support from early childhood through adulthood, both at home and at school. At Smile Train, our patient population is primarily in low and middle income countries, and many cleft-affected families and LMICs do not have access to psychosocial support due to financial constraints, lack of trained local health professionals, geographic accessibility, and misconceptions about the need for this kind of treatment. So what does Smile Train psychosocial program support? Smile Train has a threefold plan for bringing access to essential services to more of our partner hospitals, which is 1, to develop more educational resources, such as the Smile Train 9 Reasons to Smile Family Fun Activity Booklet. 2, to connect patients with cleft community groups. For example, in the Philippines and in Brazil, we offer support and information to cleft community groups through workshops, webinars, and support groups. Additionally, in partnership with the World Health Organization, we launched an event called Art Impact for Health, which uses art as an opportunity to enable Smile Train patients to express themselves and improve their psychosocial well-being. And third and last, to expand psychosocial support pilot programs. For example, in April of 2020, Smile Train piloted our first clinical psychosocial grant program at Fundación Clínica Noel, based in Medellin, Colombia. From April 2020 to January 2021, this program supported 150 cleft-affected patients and families, with more than 350 appointments facilitated. We are continuing this grant program in 2021 and 2022. Our staff and partners around the world are working hard to grow our psychosocial programs every day. However, psychosocial is still a very new space for Smile Train. And in order to scale these programs globally, we need to streamline our psychosocial grant guidelines, our grant application form, and reporting forms. This past summer, Smile Train onboarded 4 psychologists from partner hospitals as Smile Train psychosocial advisors. These 4 advisors make up our psychosocial task force, which meets monthly to brainstorm new resources and is currently working to improve and streamline our psychosocial grant program so that more partners can apply for funding and give access to our patients. One of our psychosocial advisors is Camila Osorio, who is with us today, and is a psychologist and friend from one of our strongest comprehensive cleft care partners, Fundación Clínica Noel. Clínica Noel has been serving families with cleft for well over 100 years, and their entire medical team has tremendous experience with offering holistic, supportive, and comprehensive cleft care. Camila has not only supported our psychosocial pilot program at Clínica Noel, but she's also been involved with Art Impact for Health in Peru and Colombia, and helped to write Smile Train's 9 Reasons to Smile Family Fun Activity Booklet, which helps children affected by cleft build their self-esteem. Camila has an important and unique perspective on the importance of psychosocial programs in cleft care, as well as her own experiences. Hi, Camila.
Thank you, Grace, for mentioning our 9 Reasons to Smile booklet. This is just one example of how diverse psychosocial interventions can be and how the support can be carried out. As a psychologist, I would like to mention the importance of having psychosocial support when we talk about cleft journey. As parents, when we first find out about the news that our baby will have a cleft, it has a significant impact having support, since sometimes the news can be hard to process. It's fundamental to seek information. As patients, it's common to have challenges, but sometimes with Cleft, we must face different kind of hardships, all the way from having regular visits with doctors, more than other kids, to sometimes finding ourselves feeling left out or out of place. As we pursue psychosocial support, we are bettering our chances for a good outcome in our speech therapies and any other medical interventions, as well as more positive family dynamics and well-being. I would like to encourage each and every one of you to reach out to your teams and find that support and strengthen your family bonds. During the past year, everybody had to face different challenges. No one knew what was going to happen, but despite the fear and the unknown, we were able to find new resources and methods to continue supporting patients. Last year, we were able to reach more than 30 families that had been absent from their treatment and continue their process even though they were away from home. More workshops were carried out since parents didn't have to travel and leave their homes, and more patients mentioned the overall positive effect of receiving some treatment online. We found that telehealth lets us stay connected and reach out to those who need us, and most importantly, it lets me be here with you all the way from across the country. Thank you, Smile Train, for letting me be part of this task force and lead psychosocial pilot programs. Within the task force, we want to help and support other grant programs worldwide, develop guidelines and resources that everybody can use, review and participate on psychosocial research proposals, and develop global psychosocial support. It is essential that children born with cleft lips or palates receive psychosocial support throughout their early childhood to adult years, both at home and at school, to ensure healthy development and self-esteem and confidence.
Thank you so much, Camila. We are so grateful to Clinica Noel for their partnership and for all the incredible work that you're doing to support those with Cleft. If you have any questions or want to learn more about Smile Train psychosocial programs or want to share your ideas and experiences with us, please reach out at any time. Thank you so much.